welcome to the Clinical Associates Career Information session. My name is Daniela Sefurah-Huyaman. I am your host this evening, and I'm excited to be here with all of you. So first things first, let's give a virtual shout out to all our students and guests tuning in. We've got clinical associates from 3 awesome universities with us this evening. Walter Sisulu University. I hope I see some virtual waves and high fives. Wits University and the University of Pretoria, and you all rock. Thank you so much for attending. This is the 8th installment of our monthly webinars for the year 2023. So for those who are new to the space, well, the plan is simple. We're bringing in some seriously cool clinical associates who've been there, done that, and they're going to spill the tea on their journeys in the field. We're talking about both postgraduate life, new career paths, wild adventures, epic challenges, and most importantly, epic wins. And I guess yours truly is your guide through this roller coaster of wisdom. So I'm also a clinical associate, and I also dabble in the art of teaching at the Wits Clinical Associate Program. I was the 3rd Wits University cohort back in the day. I started my clinical associate journey. I remember specifically, it was January the 4th, 2014 at Kopanong Hospital. And then I later shifted gears towards addiction care by working in the community-orientated substance use program, which is a history or an experience I share with one of the guest speakers today. I even got myself a diploma in addiction care in 2020, and I'm currently in my final year of the MPhil in family medicine at Stellenbosch University. So yep, I'm all about patient care. I'm all about health equity, health advocacy, and the magical world of clinical associates. So why are we here this evening? It's all about boosting your professional identity as a clinical associate student and building a super supportive community of practice. We're here to connect you with these awesome working clinical associates who are ready to share their experiences. So tonight, each speaker has got around 10 to 15 minutes to spark your inspiration and share the wisdom they gathered along the way. But here's the twist. We're not just here to listen to them. We're here to hear from you. So pop those burning questions in the chat because we'll dive into an interactive question and answer session after our last speaker has wrapped up. And tag your year of study and the university you represent so you can give so we can give you a virtual fist bump or maybe a heart or just a thumbs up. We'll see. So before we dive into our webinar, I'd like to set some netiquette or ground rules because, you know, even heroes have rules. So please keep those mics muted during our speakers' presentations. If you got something to say, as I said, hit us up on the chat button like a pro. Be awesome. Be respectful. Superheroes are always respectful, and support your fellow attendees in the interactive chat session. And most importantly, let's make this an unforgettable, inspiring, and super fun learning experience in which we use each other's stories to build ourselves. So huge thanks to our phenomenal guest speakers for being here with us this evening. And now, without further ado, let's give a tremendous virtual applause. I want to see those applause to our first guest speaker, Ms. Bathabile Nzimande, who is going to kickstart this epic journey with a bang. So get ready for some serious inspiration, folks. And let me start off by giving a little bit of a bio about Ms. Bathabile Nzimande. She's a clinical associate with a postgraduate diploma in public health. She boasts an impressive 5 years of experience working with key populations. Bathabile's journey into becoming a clinical associate was driven by her innate desire to make a positive impact on people's lives by assisting them in achieving better health outcomes. With what truly ignited Bathabile's passion for public health was her aspiration to extend her influence to a broader scale. While her role as a clinical associate allowed her to effect meaningful change on a one-on-one basis, She recognized that her true potential lay in addressing health needs of entire populations. In a pursuit of public health, Bathabile has embraced the opportunity to respond to the healthcare challenges faced by communities and makes a significant difference in their overall well-being. So over you to Bathabile, and thank you so much for making time to speak to our students.
Thank you so much, Daniela, for that awesome introduction. Thank you for to the BCMP coordinators for allowing me to speak here today. I am truly honored to be, one of the guest speakers. All right, so I just want to give you guys a little bit of background on my educational background and my work history as well. I think by the end, this is going to assist in rounding up my presentation from where I started. So in 2011, I completed my matric. 2012, I started at WITS. I was doing biomedical sciences initially, and then I did not complete that course though. I then went on to start BCMP in 2013, and I obtained my qualification in 2018. Okay, yes, BCMP is a 3-year program. Now you're probably asking yourselves, or not, why it took me so long to complete. Miss Haviu, I don't know if you you're probably laughing right now, but I don't know if Miss Haviu would like to explain what happened during that time. However, in 2019, I then did my postgrad diploma in public health at Monash, South Africa. So my work history then began in 2018. Okay, so I'm going to start from the bottom up. So I looked a lot when I started working. Okay, so I think that's one of the benefits we have as clinical associates. So as you're still trying to, get your feet around finding employment and a permanent post, you are able to earn a little bit of cash whilst doing a few some locums in different areas now, corner, to just add to your skills. So I started in VMMC. I think most of you should know what that stands for. So it's a voluntary medical male circumcision in 2018, and I think I last did circumcision in 2021. Okay, so with VMMC, I supervised, mentored, and coached VMMC surgical teams where I performed voluntary male medical circumcision, took history, examined, screen, and treat VMMC clients with STIs, and then you also refer appropriately, In 2018, August, I also started assisting. There's a surgeon that I assisted around that time, and then following that surgeons, I had a lot of requests to assist other surgeons in obs and gyne as well as urology cases. So basically, you assist in operative care of patients in surgery and perform duties as assigned under direct guidance of the head surgeon, which would be the gynecologist or the urologist in my case. And then in December 2018, that's when I started working with an organization called COSAP. Okay, I worked there as a clinical associate, and in the subsequent years, and then I became the site leader there. So I was employed by University of Pretoria, and we're running a program called COSAP. So it stands for Community Oriented Substance Use Program. And what we basically did there was provide holistic management for people who used and injected drugs. Okay. Whilst I was still working for COSAP, I was also able to do a few locums. I was a clinical audit researcher for a consultation a firm called MAG. So that stands for Medical Advisory Group Services. So I facilitated clinical audits at various private hospitals as a researcher. Okay. And then moving on to my current role, since February, okay, I am a project coordinator for Aurum, for the Aurum Institute. We're running a program called Pop In, okay? And that's what I'm currently doing right now. So this whole exercise, I wanted to explain to you, like I initially said, you would see there's a lot of things as a clinical associate that you can do. There's a lot of experience, there's a lot of fields that you can, move into and move around whilst you're still trying to figure out, what you want to do, where your passions actually lie, which fields do you want to do go into internal medicine? Do you want to do emergency medicine? Like, where are you? There's a lot of opportunities to find your feet. Okay, and then I'm going to move on to my current work. Okay, so as I said, I work at Aurum Pop-In. It's based in Etugan and Durban. Okay, so we are a key populations program. Okay, so what key populations are? These are populations that are at a higher risk or are vulnerable to acquiring HIV, TB, as well as STIs. So of the 5 key populations that are, we render services to 2. These being men who have sex with men, as well as transgender women. Okay. So our clinic is based in Morningside in Durban, and we offer the following services. So STI screening and treatment, TB screening and treatment, HIV testing services, and ART initiation and continuity of care and treatment. We offer PrEP, so currently we're offering 2 kinds of PrEP, which is daily PrEP as well as event-driven PrEP. We have clinicians that work here that, are able to treat for minor ailments. We also offer psychosocial services. We have an in-house social worker. We do individual and group counseling, as well as something I'm very, very happy that we're doing, very proud of, which is called GAHC, which stands for Gender Affirming Healthcare. So this basically speaks to affirming transgender identities. Okay. So we're currently offering hormonal replacement therapy for our transgender women. So these being your estrogen, for them to have a more feminine appearance, if that's what's if that's what their transition is leading them to. Some transgender women are okay with their appearance and don't want to do anything about them, but those that want to change their appearance are taking on our services for hormonal replacement therapy. So within the organization that I just described, I am the project coordinator as well as the site manager, the clinical manager. So I coordinate all activities. So we do a lot of outreach services. So areas that are not, or the people that are not close to us, so people that are not within the CBD or within Durban South, can also reach our services. So we have 2 outreach teams that literally go out every day, Monday to Saturday, to different areas to provide the same sort of services that we provide in facility, so inside our clinic. So yeah. Moving on to the other clinical associates that I work closely with, I'm very, I rather say privy or very honored to be working with 2 clinical associates that are actually my managers, one being the project manager of our program, as well as the program manager. So the program manager is a lady by the name of Matiliso Chabane, who is also the founder of our program. So these being clinical associates, and I think them knowing what clinical associates are and also being a clinical associate themselves might have given me, a certain urge or certain advantage. Well, at least I'd like to think, when I was applying for the job and when I went into the interview, and they knew exactly who we are, what we are, and what we're capable of. Okay, so yeah. Moving on to the next slides. These are some of my personal achievements. If you look onto the top left, that's a newspaper article that was based on our launch. So we successfully launched our clinic in May this year. And yeah, it was quite stressful organizing that whole launch, but it was quite successful. And we had a lot of interviews done. We had a lot of journalists come through and also write stories on the work that we do. And this is just a picture of the one of the articles that they did. One of my other personal achievements was, making Aurum 40 and the 40 list, and basically being selected as one out of 40 of Aurum's emerging leaders under the age of 40. This was 3 months after my appointment, literally 3 months after I was employed here at Aurum. Then I was selected as one of the, 40, under 40. So I thought that was really great because I hadn't been working here for a long time, but within the short space of time that I've been working here, clearly I had made some of, an effect for to be recognized. So I was really, really honored to have been, selected. And then moving on to the challenges. Okay, so most of these both challenges I've put on here, just challenges that I have personally experienced as a clinical associate. So the first being people's perceptions as a clinical associate. So number one, people are unfamiliar with our profession. So a lot of people ask, okay, what is a clinical associate? They've never heard that term. They don't know what we do. So um, for the most part, I always look at that as an opportunity to teach. Okay, so because they don't know, so you let them know that who we are, what we can do, and why there is such a profession to begin with. Okay. I think what also keeps me a little bit sane is that telling myself that I'll have to explain what clinical associates are for a very long time. So because you will always get this question, I think Miss Avua would probably, or even D with Daniela will probably also say that throughout their years since they graduated, which was many moons ago, if they come to a place where people don't know them, they say they're clinical associate, they're still being asked what a clinical associate is. So as soon as you tell yourself that this is what you're going to have to be explaining, then you won't feel very disheartened when people ask or irritated or annoyed or anything like that. Okay. And then number two, something I battled a lot with was feeling like I had to prove myself. Okay. Because easily people don't know what a profession is. And for the most part, when I worked at hospital, so a lot of my hospital experience was during my practicals in varsity, in university. So when I was working a lot in university, people don't know who we were. I don't know if that's changed now because we keep using maybe similar hospitals, so they know our capabilities, they know who we are. So they don't know our scope of practice. So you always had to prove yourself that no, I can do this, I am capable of doing this. And then you probably have had other professions, be it nurses, OTs, doctors, that then ask you like, why are you even a clinical associate? Why don't you continue to study? Why don't you do medicine rather? It's not recognized and this and that. So there's a lot of people that, constantly trying to bring you down, whether deliberately or not, people just imposing their own opinions and beliefs. And sometimes it might affect you negatively. So, and then you might then want to, constantly prove yourself to say, yes, I'm a clinical associate, but I can do this and. So I experienced that a lot as a student, and I didn't want to have to experience that in my working life. So I just had to tell myself that I don't need to prove anything to anyone. So as soon as you change that mindset that you are a clinical associate and you've graduated, which means that you got the stamp to say that you are competent and you can do what you can do, and you don't need to prove to anyone what your capabilities are. They'll see as they continue to work with you that, oh, you can do this, or you're doing more than they expected, and then they'll see it. But just don't tell yourself, because then it'll go over into being you having imposter syndrome, which you're going to carry through a lot of your life. So as a student right now, I'm telling you guys, you don't have to prove yourself to anybody. Just continue doing the work that you're doing. Continue rather proving to yourself that, oh, I didn't know this skill, I didn't know I could master the skill. And then that works better than seeking approval from other people, right? And then another thing that I wanted us to focus on were also the benefits of being a clinical associate. So I think I had alluded to the first one is being able to work and grow in different fields of work. I've looked them a lot. So there's a lot of opportunities for being in different fields, and that as a clinical associate, like, we never stop learning and acquiring skills. And this also means then we can actually practice those skills and use those skills. So basically our scope of practice is not necessarily limited, as long as the supervisor or the doctor that you're working with then feels comfortable to say, okay, I'm giving the go ahead that this person has developed adequate skill, then they can continue working independently under supervision, however. But yeah, so we never stop learning, which is great. And that's a great skill to have throughout the rest of your life. And that there are lots of studies to continue opportunities to further your studies. So you can, venture into mental health as a clinical associate. You can, do a postgrad in surgery. You can do public health. You can, venture into emergency medicine. And there's a lot more other opportunities that you can, grow your career on. And another thing that I absolutely love about being a clinical associate is, providing quality healthcare. I put biopsychosocial, in caps, because that's really what we master. Other professions will literally just deal with, the biomedical aspects of things. So they'll just look at, you're sick, and let's treat you. You have a stomach bug, let's give you Buscopan, you have this, let's give you this. But they don't look at a person holistically. And us as clinical associates, we really excel in that. And I think it comes from, the teachings from, university, that you need to look at a person holistically, that you might not know that they're sick because of, what's affecting them, psychosocially. So I think we really excel in that. And it shows in the work that we do, the quality of services that we provide as well. So moving on to, my final slide is word of advice. Basically, follow your passion and success will find you. So don't listen to the naysayers. Don't listen to people that discourage you, to saying, especially when you're in hospitals, discouraging, saying, no, why don't you just go do medicine? Why don't you do nursing? Why don't you do this? At the end of the day, if you know what your passion is, it will lead you to, your success. It sounds cliche, but once you grow older, like I have now, you kind of, understand why you need to follow your passion, because it'll literally lead you to what you should be doing, basically your entire purpose. Okay, that brings me to the end of my presentation. Thank you.
Congratulations, Bathabile, on your successes. Thank you so much for sharing. I think the take home, the most important take home, is having that passion. And thank you so much for highlighting the framework of our teaching, that holistic manner in which we try to deliver this content, and that the way we see people, and that it's about putting people first. And I think your career is a testament of what we're trying to achieve as clinical associates in the South African healthcare system, about putting people first, and even how you've been pioneering and delivering healthcare services that are holistic and they take into consideration especially marginalized groups. Thank you very, very much. Just a reminder about the chat space, our interactive chat space. So I'm going to move on to introducing Ms. Randim Cesar. Ms. Randim Cesar's journey started at the University of the Witwatersrand in 2017. She, after graduation, went on to be a clinical claims adjudicator intern at Rand Mutual Assurance, and then she became a medical invoice processing pro. She went on to work at Discovery Health as a prescribed minimum benefit specialist, and now she's back at Rand Mutual Assurance in the hospital utilization space as the management assessor. So because I'm mindful of the time, I am handing over to you, Randy. Welcome, and thank you so much for making time to be here.
Good evening, everybody. I don't know what happened. I got kicked out. Thank you for the wonderful introduction. So my name is Randy. I am a clinical associate. I'm 27 years old and I come from the east of Johannesburg. Can you see me, guys? Hello, wave something. Okay.
Yes, I was just spotlighting you, but everybody
can. All right, I got that. Because I don't know what happened previously. I just got kicked out. So I was just making sure that I'm still connected. Okay, so I am a clinical associate. However, I work in corporate, and I hope everybody is good and is having a lovely Monday. For me, it's a different story. I'd like to apologize that I don't have a PowerPoint. I was using my personal laptop for the PowerPoint. However, I couldn't drive from work, from the office to my place because I'm load shedded. So now I'm currently using the work laptop and my PowerPoint is not here. I really wanted to make it for the session. If I were to drive home, I was going to get there and I'm load shedded at the time. So I know my connection is bad. I wouldn't have been able to actually connect for the session. So I'll try and remember all of my slides and I hope it'll be good enough. So yeah, I come from a township called Tsakane, and growing up, I've always wanted to be in the health field. I just knew that I wanted to serve people, and my first option was actually medicine, and then my second option was BCMP. So I'm one of the people who actually applied for BCMP. At the time, it was still new because if I remember correctly, I applied when I was doing matric, which was in 2014, because my first year was in 2015. Yes. So I had read up about it. Fortunately, there was enough information on the website. And then I remember seeing an interview, I think Ms. Aviwe and the late Mr. Victor was part of, I forgot. It was actually on TV, and I was so excited. I was looking forward to this program. Got into BCMP. Till today, I never regretted it. I love BCMP. I'm pro clinical associates, and because I've seen what it has done for me and what it has done for my peers and what it can do for you. So yeah, studied BCMP, and then I remember we had a similar session in our last year, and Mr. Viewer had invited a clinical associate who was in corporate, which happens to be a clinical associate that I'm currently working with. She's in a managerial position right now. So I remember we were hearing from different clinical associates, and she came about and she presented what she does. And I was so intrigued, I was so interested, and I just knew it from there and there that this is the route that I wanted to take. So that's how I then decided that after graduating, I'm definitely taking the corporate route. Graduated in 2017 in December, and then I couldn't get placement. I was under a bursary. I couldn't get placement in a clinic or a hospital or whatever the case was. And then I saw an opportunity in corporate, which was an internship program. I applied for the internship program, and it was for a company that I currently work for, which is called Rand Mutual Assurance. So what we do is compensation for injuries on duty. You know, when someone gets injured at work, then it's the employer's responsibility to make sure that they get proper medical care. So what we used to do is to review those claims, review all the admissions, all the procedures that the claimants are going in for, the treatment thereafter, the physio, the OT, and all of those things. I do all sorts of things from reviewing X-rays to MRI, CT scans, reviewing the ICD-10 codes, reviewing tariff codes that the doctors are billing, and that's my day-to-day job. I'm reviewing all of those things and approving certain procedures and declining certain procedures. So obviously you need to use your medical background to know that which procedure is appropriate for which type of injury. It comes with practice. So I worked as an intern for the company. And then throughout 2018, contract got finished, however, was absorbed. And then in 2019, I was moved to a different department, which is called the Medical Benefits Department, still within the same company. And just to say, we still do have clinical associates in that department that I know of. In that department, what they do is that they process medical invoices. So all the invoices that we'll get from doctors and stuff, doctors, physio, OT, invoices for medication, all of those. They review all of that and they approve or decline those invoices. So I worked there for 6 months, and then I moved to Discovery. So how I went to Discovery is actually an interesting story because I didn't know of any clinical associate that was working for Discovery at the time. I don't know, Discovery is big. Probably the clinical associates were working in different departments. However, the specific department that I went to, there was no clinical associate. There was nothing altogether. So I saw this position and I applied. I'm such a go-getter. Literally, it only said that they were looking for a health professional who is registered with the professional body. And I was like, why not? Because nurses were applying, clinical associates. Well, that's how I saw the opportunity. Physios were applying for the same job. So I applied, and I remember my CV, I was trying to make sure that they already before the interview, they know what a clinical associate is. I think I even attached the scope of practice, and the interview was so long because I was just explaining what this role is. explaining our capabilities, explaining our scope of practice, and basically just proving myself that I will be able to do this job. So I moved into that space as a pre-auth consultant, and it was a call center environment. So basically you get to the office and you're taking calls and you're loading authorizations for hospital admissions and procedures. Because it was a call center environment, I was working under pressure. However, I enjoyed it and I don't regret it. I did that role for 6 months. And like I said, I was literally the first clinical associate to work in that department. So yes, by the time I left the department, we had more than 5 clinical associates that was actually working in that department, because at some points they wanted to employ a lot of clinical associates, and I was asking clinical associates to just send through their CVs. And currently, I don't know if there are any clinical associates who are still in that space. So I worked in pre-auth for 6 months at Discovery. Then I moved into another department. That department as well, there was no clinical associates. I was literally the only clinical associate who was there. And I was working as a prescribed minimum benefits specialist. So in that department, I was just going through different application forms from doctors and patients who were applying for prescribed minimum benefits. And then I was also it was a role where you approve some, you decline some, and obviously you use your medical background. And at the time, I had already obtained my certificate in ICD-10 coding because I was really interested in corporate, and that's where I saw myself, and I knew that I needed to get the certificate. And already when it came to tariff codes, at this point in time in the PMB space, I then exposed myself to different tariff codes, not just doctors' tariff codes that they're billing for, but including physiotherapy, occupational therapists, and all of those things. I worked in that space, I think, for 7 months, I'm not too sure. And then I decided to come back where I am currently, which is at RMA, to do what I used to do previously. Came back to RMA. Remember, guys, whenever you leave a job, do not burn your bridge, so that whenever you feel like coming back, that door is always open. So I came back to RMA, and I'm doing what I used to do as an intern, just that as a permanent role, and more on an upper scale or level. And something else that I also do is that I now currently is introduced to my role. It's a new thing, is that I'm currently also loading and approving medication. Yeah, so basically that's what I'm currently doing. I think the other question was personal achievements. I'd say it's just the experience that I've obtained by changing different positions and moving from one department to another, and actually exposing myself to a lot of just exposure to different departments. I'm also currently studying part-time. I'm doing my postgrad diploma in public health. Yep. So yep, it's just that. Challenges as a clinical associate is one, you always need to explain yourself. So master that introduction, guys. By now you must know, whenever they ask you, what is a clinical associate? You must master, you must know what to say, practice it, know what you say, and make sure that it is on point, because you will get that question a lot. And it also, another challenge is what Bathabile also mentioned, is that we are forever proving ourselves and showing that we're actually capable of certain stuff, and also proving our knowledge that there's actually a lot of things that you know, and we're always compared to doctors and nurses, and which is why we always need to prove and actually explain to people that we are clinical associates, and this is what clinical associates do. We need to advocate for clinical associates. We need to teach people about clinical associates, so that the more they know, the more they will actually respect our profession. Do I regret studying BCMP? Nope, I don't regret it. So yeah, that's just my advice. The sky is the limit. The career has grown so much. You can literally move from one company to any other company. Like I said, what I currently do is just reviewing claims. You can work for any medical aid company. You can work for any compensation company, the compensation fund, RAF, which is the road accident fund. You can work for a pharmaceutical company. I have a friend who works for a pharmaceutical company. So the sky is the limit, guys. When you see those positions, just apply. And yeah, go to those interviews and prove yourself and get those jobs. So yeah, and another thing that I also like about our profession is that we have access to many postgrad diplomas currently that you can study occupational health, public health, which is what I'm doing, and many other ones. So yeah, that's it from me.
Thank you very much, Randy. Thank you so much. While I'm seeing there's a question in the chat and we're getting an applause through. So whilst we wait for more questions, and perhaps, I don't know if Bathabile, if your video can be on for the question and answer session, and then Randy, if you can keep your video on, that would be great. So I'll start. Whilst we wait for Bathabile, I think I'll start with you, Randy, because your presentation is still fresh in our minds. I share possibly the same his career history, whereas I could gather you spent about 6 months in a role.
Yep.
And I thought my 3 years was terrible. I've never been in a place for more than 3 years, but but as they say in the current workspace, I mean, it's no longer about staying in a company for 10, 15 years. So, I mean, the space is insurance and it's in the corporate, but I'm assuming there's quite a lot of transition. So I'm curious as to what are the skills or knowledge that proves to be particularly valuable during that transition. So what insights could you share with clinical associates in trying to move and transition from these different roles? What is that skill and that knowledge that was really helpful for you?
Okay, so let me just put it like this in the lamest term, I guess. I don't know. So what happens is that companies, the class, was it 13 or whatever, but all mine companies, they pay a certain premium to the company that I work for, which is Rand Mutual Assurances. The same way that you would pay medical aid every month to cover all your medical costs, right? Now, because I saw a question about my current role and you said it's related to that. So then what will happen is that someone will get injured in the mines. When they get injured, they will submit their claim as an injury on duty. But now, because they were injured on duty, it is the employer's duty to make sure that all their medical costs are covered, which is where we then come in, because the employer pays a premium to us so that we can cover those medical costs in case of an injury on duty. So then I'll receive a claim. I'm just going to make an example. I just want to make sure that everyone understands what is it that I do. Let's say I get a request and they're saying that here's a claimant, this claimant injured the knee. And now they want to take the claimant in for a knee arthroscopy. So basically what I will then look at is that I will ask for the X-ray report or MRI report or CT scan report, whatever it is that they have. And I'll go through those to confirm that indeed there's a fracture, indeed so basically this is when I use my medical background. Am I making sense? So then I will go through those reports and then to confirm that indeed there is a fracture. So let's say the doctor wants to do an ORIF, I will then authorize it because it does correlate. So with such a role, you do need your medical background to see if a procedure is actually appropriate for this type of the injury. In medical aid, you'll check if the actual medical condition is appropriate for the type of procedure that the doctor wants to do or the type of treatment. Then based on that, we can approve or decline a procedure based on the correlation. So that's what I do. And then, like I said, within the company, I did an ICD-10 coding course. I don't know if it's available externally, but it was given to us by the company. So for people who are interested, maybe they can look up on it and get the training, because in the private space, basically the ICD-10 code is very important, because the ICD-10 code is the injury code. So what doctors would submit to us is not the actual injury, but they'll just give us an ICD-10 code, and you need to know that this ICD-10 code stands for this type of an injury. So yep, basically, I hope I answered the question.
Yeah, you did.
Okay.
So
Yes.
you have your clinical acumen. I guess you also need to kind of also know how you navigate the corporate space. So it's not just your health sciences. You also
Yes.
kind of know the industry in which you're working. And as you said, like with mining, so you have to also kind of know what the mining industry is like. So you
Yes, true.
really know the injuries. And so in actual fact, you kind of have to go outside of just knowing the, as you said, biomedical.
Yep.
Rather, as Bathabile pointed out, the importance of knowing a patient holistically and
Yes.
the environment they come from. Joe posted in the group about asking about what you needed for your role as a project manager, and if a BCMP degree is enough. So could you offer advice to these aspiring clinical associates who are interested in pursuing a career in public health, or even in this project management role within such an organization? What are the skills or qualities do you believe are essential for success in this field? It could be in this project management role, or just even in public health space. Taking consideration, we're dealing with pandemics, and we weren't ready, pandemic readiness, but also trying to grapple with HIV and TB and the like.
Just to specifically answer the question that was asked in the chat box. So for me, I had worked with key populations before, and I think for the company I'm working for, the organization I'm working for now, that was very key in knowing like what key populations are and how do you address them, how do you work with them. So I think that also gave me an advantage in this role. The fact that I also had or rather did public health I had the public health diploma, so that did come a long way, and also did a very short course on LinkedIn actually. Project management. So because there were some project management questions that were asked in the interview as well, like the life cycle of project management. So I also needed to be privy to that knowledge, so to address it, or rather to, answer correctly. So so it was everything that I've explained. So to just break it down to you, just having the BCMP degree on its own, what I don't think would have been enough. It's the experience. So experience, I think, is the biggest thing more than anything, And then because everything else you can learn through experience. So and then the things that also gave me a little bit of a benefit was the diploma. Yeah. So I don't know if I answered that particular question well. But moving on to yours, Dee, what makes a good or like the qualities that would make a good, public health professional, I think would be like having very good communication, having good analytical skills, because it's really a lot about data analysis. There's a lot of research that's involved. So if you're not a person that likes research a lot, I don't know if this is a good field to venture in, although there is, like for me personally, there is a lot of people facing. So I do a lot of stakeholder engagement. I do a lot of people facing, but at the end of the day, it comes down to the stats. So I present a lot on the targets or on our indicators as a program. So you need to know a lot about, data analysis, problem solving, and more than anything, just be passionate about the work that you're doing. Be passionate about health, and also if there's an organization that you want to go into that deals specifically about with your own passions, like myself, I think my experience has led me into key populations. So I'm really finding a lot of love with key populations. I know I've worked with 3 so far. I'm looking to expand a lot more than just the 3 I've worked with. So anything within this field. So if I have to do a research paper, a research methodology, anything within something that I am passionate about, and then it becomes easy, because I don't particularly like research, but if it's something that I'm researching that I do love, then it just comes naturally.
And I must commend both of you ladies in that pioneering aspect, because from what I'm hearing from all your stories, it was spaces where they weren't clinical associates. And so by you, and I know this is, such a popular, by you taking up space, it literally has also opened up doors for other clinical associates. And especially in areas where people never considered clinical associates. And I'm looking at VMMC and the rollout. We were never considered, but we seem to be the driving force in terms of delivering services in VMMC. And so it's interesting. I'm curious what's going to happen now with other key populations like people who inject drugs and men who have sex with men and transgender women. What the rollout is going to be like. So, Randy, there's a question from Brett. I'm interested to understand RMA and as an alternative to workmen's compensation and COID, or enhanced benefits over and above WCA. So if you can just possibly touch base and just explain that.
Okay, so RMA is an alternative to WCA and COID. So basically, remember, we've got the compensation fund, and the compensation fund takes care of all industries. However, RMA only takes care of the mining industry and the steel and the metal industry. Then compensation fund still takes care of all other industries for the compensation for injuries on duty. So we only take care of the two, and yes, we are governed by the COID Act. So it is an alternative for COID or WCA. I hope you answered, Brad.
So maybe whilst we wait for more questions or before we wrap up, then
okay,
is there then a possibility, I know you then work in the claims, if someone then had to transition into these mining companies and steel companies, so just your corporate experience, is there that possibility that, once you've done it RMA, I hope your bosses don't watch this, we're not poaching, but, could they then be, because, some of these mine companies have health and safety,
yes.
and they show and wellness programs. Could a clinical associate possibly pioneer to then join maybe an Anglo and take their skill sets from working in this insurance into the actual company itself?
Honestly, I'm not too sure. However, I think it might be possible. There's a new department where I work, which is the preventions department. So what they do is that they go to all of these different mines and try to give advice or check the working environment and assess the working environment. And then based on that, I think they give a certain discount to the premiums or whatever. So I think, there are a lot of opportunities, especially. So there's a claims department where clinical associates are working in. There's the medical benefits department where clinical are working in, where they're processing invoices. There's the actual medical department where clinical associates are working in, where they deal with the medical treatment, your medication, which is the department that I'm in. So there are lots and lots of departments. There's one clinical associate currently who's in the quality assurance space. So especially when you're in corporate, you just need to move around and get as much information as possible. And then I also mentioned that I worked for Discovery. Discovery is huge. There's the chronics department, there's the PMB department, there's the case management department, and all of these different departments just need someone with a medical background. So I think for me, it was just a matter of getting in and then moving around and seeing where is it that I find fit. So there's also a rehab department now, which is also new, recently launched in my company, where they go to all of these people who have been injured. It's a biopsychosocial. They just find out from them, especially the people who end up being pensioners, people who get serious injuries where they lose their limbs, which is also an interesting department. They go to them, they check how is it that they're doing. They check their surrounding, their area. They check their mental health. They do certain assessments and stuff, and they come back to the company, give feedback, and see how is it that they can assist them. So there's a lot in the corporate space.
Definitely.
There's a lot.
And I think, in what we've looking at what your stories are about and looking at your postgrad achievements even, is that BCMP is just but a foundation. It's an undergrad, right? So under, if you have to use that analogy, the foundation goes underneath, right? In a building, you're never going to see the foundation. What you're going to see is what you build on top of that foundation. And so ideally, our BCMP degree should always be considered at that. It's the foundation. It's very strong. It keeps, the house or the building anchored, but you need to build on top of that. So if you are expecting to get the recognition, if you want to make an impact, you're going to have to build on this foundation that's given in your undergrad career. And I'm so happy that that's, with what you've presented and even the previous stories that we've gotten from webinars, is that there's always that consistency with every single graduate about showing that importance of how do you build on that foundation. So with 3 minutes left of this evening and no other questions in the chat space, I'd like to give you each an opportunity to just give us a short summary or a word of inspiration. I know students are getting into block tests. Our final years are stressing about the national examination. So what would you like to say to these future colleagues that are on the space, and those who have load shedding who will be watching the recording? What would you like to say?
Okay, so I'd like to just let them know that they mustn't be discouraged. They probably chose the right career that will open many, many, many doors, and it's all in their hands. And it's up to them to actually decide which route is it that they will take. However, there are lots of opportunities out there, provided that they go out there and they actually look and search for these opportunities. And yeah, that's that. Or just to also add on, there's also in my workplace, also we also work hand in hand with doctors who will then review all of these complicated cases, your spinal fusions, your knee replacements, and all of those. So yeah, there's quite a huge opportunities out there for clinical associates.
Thank you, Annie, for that. I think I just want to, just mainly end on that and then build on that. It's just, I had slightly alluded to this earlier. It's just like find your passion, find your niche, and build from that. I like that we came to the conclusion that BCMP can form part of any foundation. You can grow from strength to strength, depending on what your aspirations are, what you want to do, which field you want to venture into. So find your niche, study hard, do your practicals, go to hospital. And inside joke. And then and yeah, the sky is literally the limit. There's endless opportunities for growth, and there's many, many fields of areas that you can expand within, BCMP and anywhere else you want to go, guys. Do not be discouraged. Don't listen to those people. Listen to us. We live this, okay? Who best to hear from. So thank you so much for tuning in, and yeah, all the best.
So much. Yeah, that brings us to the end. So I'd like to send a heartfelt gratitude to our fantastic guests. Thank you, Randy. Thank you, Bathabile, for sharing your inspiring stories, wisdom, and insights with us tonight. Your experience, I think, have left an indelible mark on us all. But the inspiration doesn't stop here, hey? As students, and even as graduates, if I think about it, we need to continue this journey in this world of healthcare. Always remember the valuable lessons and guidance that was shared today. And for me, it's always going to be about putting people first. Your path as a future clinical associate, as a healthcare professional, needs to be mindful of that. And where it's filled with infinite possibilities and opportunities to make this positive impact. So thank you to our wonderful audience. Thank you for your participation. So we're going to just remember that this is recorded and that we will be putting it up on our social media platforms. It will be on YouTube for you to engage with and to even share, with others, share with your families. And so as we conclude, let's carry the passion, the knowledge, and the camaraderie, this wonderful community of practice, and together we make a difference, one patient at a time, one community at a time. And thank you so much. Have a good evening, keep safe, and enjoy the wonderful warm weather and this wonderful season.